welcome back to another game, another day. No, today this will be Bio Ink Redemption. Hello, Zoro is always lost 247. Welcome to the stream, and today we are going to do Bio Ink Redemption actually. But here's the thing, before I do that, there is, let's see, I was gonna do the last of the jumping jack set, but I'm gonna save that for another stream, alright? But yeah, today we will do, wait, how's the sound by the way? Does the mic work? I think the mic works, right? It does work. 1 second, let me just check. I'm not muted. Yeah, it works, it works. Okay, how about the game music? Does it work? Yeah, it works. Alright, so today it is Bio Ink Redemption Day. Oh, the fan. 1 second. There you go. Okay, today is Bio Ink Redemption Day, and I'm going to try and save as many patients as I can. Hopefully, they get saved, but if not, womp womp. So we're gonna choose life. Choose life. Continue life campaign. I'm not sure. Yep, there it is. Let's do which one? I wonder if I should go with med school, clinic, or hospital. Let's check if I finished all of the med school stuff. Oh, I did. But the hardest part of residency, I did not finish this one. So let's do it. Lethal mode. And let's go with John Smith. Can we save John Smith? No, I don't want to do skill slots because Okay, but we're playing lethal mode now, so that means I need... Should I spend this? Yeah. Economy. Fewer symptoms. This one, narrowing them down will help. Intensive, let's go with ICU. All diagnostic tests are 10% cheaper. Oh my gosh, yeah, the treatment too. No, diagnostic tests. No, why? Money? Okay. Then I'll do... Wow, I can't exit. Then, let's start. Let's go. Lethal mode. Let's go residency. Okay, John Smith has a few symptoms and his overall health is suffering. Identify and treat all diseases in less than 150 days. How are you, John Smith? Okay, we have money now. 3, 4. Wow, muscle weakness, fever. Which one has the shortest thing? A lot of head type of thing. The muscle weakness is very concerning. 64% in the brain. And this one, what's up here? Let's just check. Dizziness. 61% here. This might be one. Let's go with the UV testing. And I want to check his cardiovascular health. So I'm gonna do... Wow, I don't have money. I was gonna do a metabolic panel, but... No money. No money. This game will actually try and connect all of the things I was talking about in the previous streams, in the previous science streams. So hopefully it works. If it doesn't, well... Womp, womp. Oh, nice. Metabolic panel. Oh, no. He is really sick here. Tisk. This. Stomach pain, the muscle weakness. Big concern. Brain, pet. Pet scan, let's go. Okay. 69% life. No. 67. Wow, you're dying quickly. Okay, at least you know how to sleep properly now. Parkinson's! We found it! Parkinson's. How to treat 14 levodopa. Oh my gosh. Parkinson's disease is a progressive disorder of the nervous system that affects movement. While a tremor may be the most well-known sign of Parkinson's disease, the disorder also commonly causes stiffness or slowing of movement. Levodopa and carbidopa is used to treat Parkinson's disease, sometimes called shaking palsy or paralysis agitans. We need 14. We need money. We need money. My gosh. Let's go. We can save this patient. It's gonna work. If not, womp, womp. Okay, let's see. Let's get that one. Do you have 14? I don't have 14. We need to treat that stat ASAP. ASAP. Oh my gosh. Give us enough. Oh, the last money. No, you're not sick. You're not sick. If you pretend you're fine, then you're alright. There. We have enough. Stop. He's being sent to the ER. He is being sent to the ER. But things cost less. Okay, that's being fixed now. Shortness of breath. No. Oh dear. Shortness of... Oh, this might be it. Chest x-ray. Because, come on. Do you think asthma can decrease this part that much by 80%? I don't think so. Oh no. Our patient. My dear patient. Oh, this is really lethal mode. Nope, we found it. Oh, it's both asthma and sarcoidosis. It's a growth of tiny collections of inflammatory cells in different parts of your body, mostly the lungs. So inflammatory cells, granulomas, lymph nodes, eyes, and skin. We need corticosteroids or immunosuppressive drugs. I'm going to use corticosteroids, but I need one more money. One more coin. There, that works. Treat it with corticosteroids used to provide relief for inflamed areas of the body. They lessen swelling, redness, itching, and allergic reactions. They are often used as part of the treatment for a number of different diseases, such as severe allergies or skin problems, asthma, or arthritis. Yeah, do that, prescribe that. And, we can treat asthma. Inhalation corticosteroids are cortisone-like medicines. They are used to help prevent the symptoms of asthma when used regularly every day. Inhalation corticosteroids decrease the number of and severity of asthma attacks. However, they will not relieve an asthma that has already started. So they're just preventive measures. Now for the back pain. Is he just old? He might just be old. There's something wrong with his heart. But not so anxious. Can't even treat it now or find out more. Oh, no. Stop dying. Come on. Treat 1 out of 9 diseases. Crazy. How can I treat the patient? This rate. They did not get checked early enough. Come on. Stop. You're fine. You're not sick. Just think that you are alright. This might be the thing. Major depression. How can you check it? This. Maybe this. Brain PET, no. MRI, no. This one. Psych assessment. And metabolic panel. Just so we can check lots of more stuff at the same time. Come on, don't die, please. Circ. And his systems are failing. We found high cholesterol. How can we fix that? Maybe you just ate too much lechon. Stop. Just. No, you're not depressed. That's good, but we wasted money checking it. Let's see. And let's get this. Come on. Oh, we can check a lot. Nice. Let's treat your high cholesterol. I think with statins, this will be quicker. Now, let's go with back pain. Oh dear. Physical exam or fibro? Maybe this? It might help. It's a bit cheap. Mood swings. So, psych. This. I'll check that one. Come on, go. Go, 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 go. No! No.
Whoa.
Oh, stop. Stop being sick. Imagine if you can just tell a patient that. Oh! Chronic stress and nervous breakdown. So, here is the nervous breakdown. The term nervous breakdown is sometimes used to describe a stressful situation in which someone becomes temporarily unable to function normally in day-to-day life. You could assign anxiolytic or anti-panic or anti-anxiety agent. It's a medication or other intervention that inhibits anxiety. This effect is in contrast to anxiogenic agents, which increase anxiety. We don't have enough money to treat that. Oh, by the way, you can also do psychiatric counseling in which a psychiatrist is a medical doctor MD or DO who specializes in preventing, diagnosing, and treating mental illnesses. A psychiatrist is trained to differentiate mental health problems from underlying medical conditions that could present with psychiatric symptoms. But even if we read this, we don't have enough money to treat the patient right now. So let's just get more resources. This is very reminiscent of a real-life hospital, I think. Come on, let's get that one. That might be enough. Is it? Do we have a 3? Yes. And that's gonna take too much days. Anxiolytic, yes. Perfect. Now for chronic stress. The chronic stress is the response to emotional pressure suffered for a prolonged period of time. Stress symptoms include anxiety, depression, digestive problems, heart disease, and many more. And let's use antidepressants there. It costs 4 money, but we don't even have 4. Unfortunate. Oh. And reporting that the patient actually just moved on to a different part of the universe now. Parkinson's disease caused John Smith's nervous system to collapse first, which then led his immune system to collapse. Okay, got it. We'll do it again. Alright? Because this is the hard mode of residency, the lethal mode. For level 4. Circulatory and muscular, skeletal and nervous. He is old. Okay, money. Okay, what's up here? Paralysis. Hello, the one son. Thank you very much. We will try to save many patients actually today, but I don't know if we can do that. So let's see. It says paralysis. I will 62, 57. Stroke. No, we don't have 12 coins, so that's gonna be a little bit difficult. So let's see if we can do this. Back pain might work. Then I'm gonna do chest pain, anxiety. Nope. So here's the thing. If it's paralysis, abdominal pain, shaking, a lot of it is the neuro issue, shaking, and we don't have enough money to treat it. So I'm just gonna have to wait for more coins. Have you been playing for a long time? Nah, this game I just play it on and off. It depends. But right now we are doing the lethal mode of the medical school route, because that's the only one I haven't finished for the medical school route. I finished the others. The first patient for this route, unfortunately, moved on already to a different dimension, but I have to treat them. Hello, Aitor. Welcome to the stream. Oh, I forgot to introduce myself, by the way. Hi, I'm Millennium, Isekai'd Masked Knight Empress Scientist, and sometimes I do Pokemon, Pal World, Science, and streams like these games, for example, because they just tie together with a lot of the science stuff I talk about in the previous streams. But yeah, we are trying to save this patient, which but here's the issue. They're really dying right now. I'll wait until we reach, was it at the 50% mark, where they'll get sent to the ICU and everything just costs a little bit less. That's perfect. Okay, actually no, that's not perfect. Well, they have stroke, blood clots, and hypertension. So for stroke, a stroke occurs when the blood supply to the part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and food. Within minutes, brain cells begin to die. That's sad. So for stroke, we can use thrombolysis, known as thrombolytic therapy. It's a treatment to dissolve dangerous clots in the blood vessels. They improve blood flow and prevent damage to the tissues and organs. Aspirin, known as salicylic acid. It's a medication often used to treat pain, fever, inflammation. Aspirin is also used long-term at low doses to help prevent heart attacks, strokes, and blood clot formation in people at high risk of developing blood clots. You may have heard of a parent or something using it. Let's use aspirin on that one. And this one, anticoagulant might work. Okay, hypertension, high blood pressure is a common condition in which the force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. How are you? It depends if this patient gets saved. Maybe if we use diuretics, it might work. This one, I need one more coin. But, okay. Slowly but surely, we're treating them. Okay, one disease treated. I lost, I think, 2 or 3 coins. This one will work. We have anticoagulants now that will prevent leg swelling and all of that. How about this? We need 8 coins for hemiparesis. It's a weakness of the entire left or right side of the body that's awful and hard to do or to navigate through in day-to-day life. Look at that. Now they are in the ER. Now they are in the emergency room. This is an emergency. This is actually an emergency. Stop. Oh no. They're literally dying. No, stop. Don't die. Not yet. Now we have 6. We have 6 money. Now, physiotherapy. Okay, that will treatment of disease, injury, or deformity by physical methods such as massage, heat treatments, and exercise rather than by drugs or surgery. This will take 25 days, but it will help. Now, this abdominal pain is a big issue. Will there be a stream tomorrow? Yes, there will be, I think. It might be the science streams and stuff like that, but with the waiting room, if it is posted, then it'll be there. Yes, and look at that. They're facing chronic stress, and I don't even have the money to check. Sag. Systems failure. But yeah, feel free to combine the science streams. Those are funny. The best discussion so far, I think, was the best ice cream flavor. And it was mango, strawberry, cheesecake, vanilla, what was it? Mango, strawberry, cheesecake, vanilla. As long as it's not mint choco, then we're fine. Not mint chocolate. Same as the ice cream song. Cookies and cream also, that one's a good one. Okay, now we get more money. Come on. Oh, we found it. They are stressed. We found chronic stress. Chronic stress, it's a response to emotional pressure suffered for a prolonged period of time. Stress symptoms include anxiety, depression, digestive problems, heart disease, and many more. Again, chronic stress is the response to emotional pressure suffered for a long period of time. Are you under stress? Maybe. So let's see. Stress management therapy is 3. Antidepressants will work much better. Alright, we found it. Oh no, look at their circulatory. We lost them. The patient. Oh no. Intensive care, we have to fix it. Can we fix them? Reduce all research diagnosis delays by 20. No, I'm just gonna find. What's the strategy? Oh no. Oh, it might be. You know what? I think we found all of that. Anxiety, we haven't found. Oh my gosh. This is stressful. Not this. Maybe this. Let's go run that test. I don't think we can save this one. It's lethal mode. But there should be a tactic. What's the meta for lethal mode? How did you create the character? It is conceptualizing, for example, like Sword Art Online and all of that. And yeah, thank you very much. It is a combination of a lot of ideas, an amalgamation, in fact. Let me see, let's save this. Anxiolytic for the nervous breakdown. Perfect. Sword Art Online, and actually during karaoke streams, feel free to come by. I removed the mask. The mask can be removed. And there is also the crown can be gold as well. So yeah, it has a lot of different like emotions. Let me see. I can actually try to demo it while this patient is just. And there you go. Let me see. Retry. Residency and objective. Regarding the character, before I like do that one, like during karaoke streams, I actually use. Nope, yeah, there you go. I remove the mask, and then I can use this mic and remove that hand thingy, and then we have this emotion. If I'm confused, and then the crying. That there, it's there, and then there's also the shocked one. But yeah, what else? There, the crown can be gold. But that's the mini tutorial of what's up. And now we go back to the residency lethal mode. Respiratory. Okay. Targets. Predictions. Muscle weakness. Look at this. So it's something, maybe Parkinson's again. And maybe they're old and muscle issue. Groin pain? Yeah, this one's it. It might be just be testicular cancer. Yeah, it's the only possible one. So we're gonna treat that one, especially if it's cancer. In the previous science stream, we've learned what is cancer, uncontrolled cell death, unlimited proliferation. I mean, cell death, what is it? Cell death that doesn't happen. And they just times two. So uncontrolled proliferation. And then what else? Genetic mutations, and then they can be about hearing loss. Interesting. I'm just gonna have to treat testicular cancer first because that's cancer, and then for the heart, that's an issue as well. No, not that. I want to do metabolic panel. It's not here yet. Whoa. They know. Oh, maybe the metabolic panel only appears when it's, let's see, in the ER. Okay, muscle weakness, that's an issue. Might be this, hemiparesis or Parkinson's disease. Are you winning? Hello, Exmo2. I am not winning. I apologize. So far, 2 of the patients have passed on to a different area of the universe, but we're trying to save them slowly. Here's the thing. We are using... This is the level 4, so the hardest mode. It's the lethal mode of residency. So I'm like, why am I doing this? I don't know. Because it's the last one in the medical school route that we haven't finished. So yeah, hopefully we save at least 1 patient. Come on. So they don't have... Thank you very much. I have my mini like artist studio thingy that I was in contact with for that. Testicular cancer. It is testicular cancer and it costs 15. Money. Let's just add the word 15,000 to treat them. Like, let's add 1,000 pesos. Imagine. Let's just add the word money for the currency. Let's see. Oh, no, we don't have that one. Do we have more? There you go. Bio points. Resources. Come on. Let's do this. Okay, we have enough money now. And they are in the ER. Okay, 20. Everything will cost a little bit less. Orchidectomy. Specific method where one or both testicles and the full spermatic cord are surgically removed through an incision in the lower lateral abdomen. Okay, just through that one. We have to treat them. Hearing loss, we can solve that. It's just Alport syndrome. Urinalysis will find it. That's perfect. Fatigue is a big issue. Anxiety as well. Oh my goodness. Psychiatric assessment. Hopefully we find it and we don't waste a lot of money for that one. But yeah, that will really help. Okay, now let's see. Oh, we found it. Yeah, it was the hearing syndrome, and we don't have enough money to treat it. Nope, never mind. Oh my gosh, we don't have enough money to treat it. What's happening here? How much was it? 4? Okay, that's fine. 4? Oh, the nervous, renal, and immune system actually disappeared now. It's okay. We can get that back. ACE inhibitors. Okay, so here's the thing about Alport syndrome. It is a genetic condition characterized by kidney disease, hearing loss, and eye abnormalities. People with Alport syndrome experience progressive loss of kidney function. And ACE inhibitors would be, what's this called? They help relax blood vessels and prevent an enzyme in the body from producing angiotensin, a substance in the body that narrows your blood vessels and releases hormones that can raise your blood pressure. All right, so that's perfect. How about fatigue? Okay, nope, it's gonna be Addison's disease. Maybe. Which one? Oh my gosh. How much to find it? It costs a lot. Costs a lot. Let's see. Oh, this one. Found it. Give. Oh no. We lost the money. No. Don't disappear. They pop up. Okay, what happened? Another one. So what is this? Yeah, less syndromes will help. We already did that. So predictions, any predictions? Brain and heart. This one might be chronic stress or Parkinson's. Leg pain and blood in urine. Mood swings will help. Okay, let's just get some money first. Maybe it might be Parkinson's. Alright. But the blood in urine, that is worrisome. And look at that. Circulatory system just going wild. Oh my god. Going wild. Let's see. Leg pain, ultrasounds. Run the test. Kulang pa. One more money. Every time. The lethal mode it's very difficult. You know? I think they really upped the level for this one. So what's up? Muscle weakness. It's gonna be Parkinson's, muscle weakness. What else? Muscle weakness, brain PET scan, brain MRI. Run the test. Yeah. Do we have money? Yes. There. Check that. Thank you very much. Oh, no. Oh, that would have been good. That was a lot. 4. What else? Leg pain, ultrasounds. Run the test. One more money. Sag. Leg pain. 4. Oh my gosh. We're out. We're really out of money. Parkinson's disease. We found it. 14. Levodopa. Tisk. That'll take a lot. Okay. There you go. Respiratory. Nice. We have enough now. We have 18 coins. But it's almost being sent to the... Okay, now we'll treat this now. Right now before it even escalates. No! Blood pressure test. Let's get one more money and do ultrasound. I think we'll find something there. And now you're in the ER. Wow. I could have saved about 3 more points in terms of the levodopa. Okay, find that. Thank you very much. The blood in urine. Metabolic panel. Very good. Did I do... Yeah, do your analysis later. Parkinson's is being treated. Okay. Good, good. Lethal mode, lethal mode. Nice! We found it! Oh no, not the metabolic. We found it, so it has a combination of post-phlebitic syndrome caused by damage to your veins from a blood clot. This damage reduces blood flow in the affected areas. Deep vein thrombosis occurs when a blood clot thrombus forms in one or more of the deep veins in your body, usually in your legs. Deep vein thrombosis can cause leg pain or swelling but may occur without any symptom. Treat it using clot busters. Perfect. That's working. Anticoagulants for the clot. Oh my gosh, oh my gosh. It's gonna work, it's gonna work, it's gonna work. And we lost their muscular system. And the system failures. Oh no. No. Calm down. Yeah. Calm down. It's alright. It's alright. We'll save them. We will save them. This is gonna work. It's gonna work. See? See? Look. Now, let's use this. Then we don't have enough money. But for the blood clot, let's just use anticoagulants or blood thinners, class of drugs that work to prevent blood coagulation or clotting. Such substances occur naturally in leeches and blood-sucking insects. A group of pharmaceuticals called anticoagulants can be used as an injection, as a medication for thrombotic disorders. Alright, treat that. And this needs 8. We need 8 coins. I need a couple more coins for this. This one works. Perfect. Now treat that. Thank you. There. Combination of blood thinners, clot busters, and all of that. Now, the blood in urine. We were not able to find it. This, though. One more coin needed. One more coin needed. There, found. You do your analysis. Go. Output. Might be output. Confusion is an issue. It might be this. Insomnia costs too money. We can do that. We can do that. That will really work. Oh, digestive system. Found it. Okay, Alport syndrome. It is Alport syndrome. We could have used your analysis earlier. We need 2 more coins for the ACE inhibitors, aka they help relax the blood vessels. Angiotensin converting enzyme. They prevent an enzyme in your body from producing angiotensin 2, a substance that narrows the blood vessels and releases hormones that can raise the blood pressure. Because you want to lower the stress there. And so here's the thing. We have to think again of our strategy. What's the strategy here? So look, I went to the med school route. I went to the med school and I finished internship all 4 levels. Diagnosis all 4. And then now we're doing the residency route. Lethal, the 4th mode. See? Now you see why it's difficult. So we'll keep doing it again. Okay? Let's see. I think all not lifestyles. Risk factors, this one. We need that. Environment. All treatments. All intensive care operations, no. Recovery starts at 10%, no. All treatments are 10% cheaper, yes. Oh, no. Let's go with all diagnostics. Now, how about environment? Resource upgrades, nope. Resources stay for... Oh, this one will really help. Degree systems collapse. No. This one. Nice. Start game. It should work now, right? We can save the patient now, right? Yes. Yes. Okay. Let's see. Circulatory. Okay, what's up? Shaking. Parkinson's. 8 or 10. We need it. Stat. We need to target that one. So all resources will go for an MRI. Come on. MRI will work. Circulatory. Nope. There. No. Stay. Okay, MRI time. MRI. Brain PET scan. Hemiparesis. Nope. Parkinson's. Let's go with brain MRI. Do we have something here? Oh, PET scan. Yes. Dementia, Parkinson's. No, let's go with this one. It can check a lot more. Hopefully that targets at least 2. Hopefully we find at least 2 with that. But if we find the Parkinson's immediately, that will increase our chances super quickly. The issue now is the muscular. I don't know if that's just because they're old or... what does that mean? And wow! Look at that! Brain MRI found dementia, nervous breakdown, chronic stress, Alzheimer's, and Parkinson's. That's perfect. Well, all of these, that's crazy. So, Alzheimer's versus Parkinson's, 12 and 14. I'm just gonna have to save up a couple of money for that. What's this? Diagnose at least 3 diseases plus 40% harvest power. Will that help? No. Maybe not. I'll just save money from here. Oh, let's get this. 11? No, it's not enough. It was 12 and 14, right? Yeah, it was 12 and 14. So we'll just need a couple more. Just one more. And you are now in the ER. It's not perfect, but it helps. So treat Parkinson's right now. And how about this? We need 9. Stress management. Fine. 4. And this, no, we don't. We need a couple more money for that one. But we found like 5 or 4 diseases immediately, so that's good. Very nice. Hopefully that's a good start. This, okay, let's save it. Anxiolytics. And nope, not enough. Not enough, definitely. 6 and 9. No, 1, 2, 3, 4, 5. 5 diseases immediately with MRI. So I think, that's a good strategy. I'll save that. Come on, get this. Thank you. And get this one. And get that one. The last one. Perfect. Now treat this. Was it 9? No. Dementia. Alzheimer's is one of the... Yes. Slay. Very good. Nice one. What's up? This is an issue. Metabolic panel. Let's go. Yeah. Because, look, it's only 26% left. This is also an issue. What's up here? Let's just treat the one that we found first, and then we can move on to the next one. It's alright. Come on, breathe, patient. Breathe. You can do it. Breathe. Stress diet. There. And 1, 2, 3, 4, 5, 6. Oh my gosh. This is pretty close. Pretty close. Laziness. Let's wait. I'll get a little bit of money first, and then we'll treat that one. Come on, no, don't disappear. Oh my gosh, it disappeared. How much? 6? No. 2 more. 2. Dalawa. Come on. It's pretty close. Nice one. Okay, now we have enough for that. Cholinesterase inhibitors communicate. Okay, the inhibitors enhance communication between nerves and muscles. These medications don't cure the underlying condition, but they may improve muscle contraction and muscle strength. Perfect. Now let's... Oh no, the fatigue could be anything there. This shortness of breath. The fatigue is a big issue. Okay, it might be this. My gut feel says it's this one. I'm gonna have to do a chest x-ray on this patient's stat. John Doe, chest x-ray. Immediately. 5. We need 5 money. 5 coins. I think this is 5. See? Oh, perfect. Thank you very much. Chest x-ray right now. Nice. And then... Okay, let's wait for that. Quickly. Please find it. Nice. So it's asthma. You're asthmatic. 4 inhaled something. And okay. I'm gonna wait 2 more because I want to treat the sarco something first. And this one. What was it? Sarcoidoma? Sarcoidosis. Corticosteroids. Perfect. And the asthma, I need 4 inhaled corticosteroids. Come on. Save this patient immediately. Nice. 1. How much was it? 4? 6. I think it was 4 for corticosteroids. Inhaled corticosteroids. Yeah. No, we're not losing you. This is already 6 out of 9 diseases. 7 out of 9 diseases. Oh, no. No. Okay, we're losing it. So close, though. Just 2 more. Org. If they're male, might be the aneurysm. Because look at the life. Look at it. 3%, 2%, 1%, and bye-bye. We were so close. Was it like 8 out of 9 treated or something? It's alright. At least, okay, we know now. Brain MRI. Okay? How much is it? There. Let's do that immediately. Okay, 10. Need to save up 10. All resources for brain MRI. Nice. Just a couple more. Heist. Very heist. Nice. Now, go. Go. Run that test. And then it turns out it's not that issue this time. But it's okay. There's only so much, what's this called? Combinations that they can do to make it as lethal as possible. So while that happens, we're gonna collect money. To save the patient. Parkinson's. We found it's only 1. Yeah. So it's really a different case. What else? How about, so we did brain MRI, electrocardiogram, pulmonary. Nope. How about this? I want to check something. Shaking. This one's a concern. Oh, it is. It is a concern. Treat this now. Epileptic. Wait, you haven't found it. How come? Parkinson's. It was positive. So I'm just gonna have to use 14 money to treat that first. Good. Nice. Oh no. We're losing the patient. Time and money. This. Okay, there you go. It's alright. Calm down. It was so close earlier though. Unfortunately. We lost that one. What's the mood swing? Psychological? No, not as much as an issue. Let's use 7. It's gonna work. A little bit. Abdominal pain, anxiety, swelling, bruising. Where is the nausea coming from? Are you alright? Drink water. There. 2 and 1 and mood swings. Might be this. I want. Okay, nice. We have enough money to check that. The skin rash is an interesting one. Okay, I'm gonna have to put more coins for their nervous system. Oh my gosh. Intensive care. Where is it? Near this one. We need 14. Nope. Stop. Don't tell me you're already being sent to the ER. Okay. We found some. 6, 3, anxiolytics. This one is chronic stress, 3 and 4. Okay, a little bit. Please. There, get that. Get this. Nice. Okay, how about this? Do you have enough? 7 days, perfect. How about you? Okay, a little bit, like 5 more. So that's 6 total. Perfect. Okay, now do that one. Cholinesterase inhibitors, aka... Okay, dementia, it's an uncommon disorder that primarily affects the frontal and temporal lobes of the brain, the areas generally associated with personality, behavior, and language. Okay, that works. Enhance the communication between nerves and all of that. There's an issue with her back pain, abdominal, and skin rash. Skin rash, though... Oh, this might be it. Necrotizing and skin cancer, but we don't even have money to have that checked for this patient. And their nervous system is going bye-bye now. Don't mind it. Hello, Matthew. Of course. Thank you very much. We're trying to treat this patient. Don't mind the first, I think, 40 minutes of the stream where maybe a couple of them may have flown to the other universe. Because here's the thing, I'm playing the 4th. It's the lethal mode of the med school route for this one. So it's the hard one. So don't blame me if we lose. It's just a training. It's a training. I don't know how they make this so difficult. The human body is it's so difficult. But yeah, it's interesting. There's a big example, by the way, here where the renal system. Okay. 1 second. Focus. Back pain. Where can they be? Leg pain? You only have a few. I think it might be this syndrome. Check it using ultrasound. Thank you very much. And for dizziness, you only have a few. Let's have you check UV testing. Good. Check that. Back pain, that might be an issue. Physical exam, just to be sure. Okay, there. Go, my dear patients. Of course, the physical exam was useless. What a waste of money and time. And the skin biopsy we wasted. And photosensitivity. They are sensitive to the sun. That's why stay inside. Okay. Now let's get this treated. 43%. And you found testicular cancer and blood clots. If it's cancer, treat it immediately. We need 11, so we need 7 more money. 7 plus 4, 11. Okay, let's a little bit more. Oh, that one's a lot. And we got 2 here. Nope, don't disappear. And it disappeared. Of course it disappeared. Why make it so much easier, you know? How's this? Blood clots? No, I'm gonna put the money off to treat the testicular cancer first. Brother is at 1 HP. Yeah, unfortunately. It's alright. It's gonna improve, right? Cross your fingers and your toes and everything that can be crossed. Please. And thank you. There, you have 21 coins. Let's treat this. Efficiency, yes. And the testicular cancer. This one is a method of orchiectomy by removing one or both testicles and the full spermatic cord, or surgically removed through an incision in the lower lateral abdomen. Yeah, go do that. And swelling and bruising. Oh, we found this. Can you treat this? Yes. Good. Yes, it is. Now we just need to treat headache and nausea. Any guesses as to what it is? It might be this actually, because it's now 12%. So I'm just gonna need a couple more coins. Come on! Please let this be the round that we win. Please. Hope that this patient survives. Oh my gosh. The heist. Come on. Reduce all diagnostic research. Respiratory health. No. What was it? Anabolic. What was it? there, muscular, and he's gone. He's gone. He's almost gone. He's literally almost gone. Headache. Who? Who? Okay, yes, I feel like it's this one. Run test. Nausea and headache only. It's just the last two. We're so close to winning. It's 7 out of 9. Fan. Okay. One more. We can treat that. It's gonna be fine. It's okay. It's totally fine. Yeah. It's alright. Now, so here's the strategy. Fever, paralysis, blurred vision, headache, and skin rash. What do we think is the thing that's happening to this human being? So, and anxiety and dizziness, and elevated heart rate, leg swelling, irregular heartbeat. They just need to watch more anime to solve all of these, but let's see. Fever can be caused by a lot of these. Paralysis, only a few. Blurred vision as well. So let's target the paralysis and blurred vision, okay? Blurred vision, my gut feel is it is hemiparesis. Okay, so we're gonna do that. Let's wait. Because we have to treat 9 diseases before the time or their life runs out. It's gonna work, This patient will live. All of them are named John Smith, so they're just clones of each other. There, a couple more. Let's get these. Ooh, that's a good angle. Yeah, 9. That's why. And look at the lifespan now. There's 3/4. It's 75%. So now you see why it's. See? Run this test to check hemiparesis. Paralysis is an issue. It might be this one. Yes, no problem. Now this one is stroke. Yeah, it's funny because like I've just been doing this route numerous times already, and they keep dying. I'm like, wow. Hello, Elmore. Very good. Thank you very much for coming by again. Yeah, we're trying to save this patient. Not just this patient. This game is called Bio Ink Redemption, and you try to save a human being. Well, and just check the symptoms that they have. Get money here. Try to. Oh, look at that. Using the thing that using a neurological exam, we found out that they have stroke, hypertension, blood clot, and hemiparesis. So now we go and try to treat this, because if we don't fix the hemiparesis, then their brain power, they will just die. Essentially, they will die. We don't want them to die. We're trying to save them. Okay, we found this, a blurred vision. You have 4, 6, 4, 5. Brother has to be an alcoholic, smoker, insomniac, low white blood cell. Exactly. And don't forget, yeah, that's true. And they don't even have a lot of the risk factors. Wow, brain MRI. They don't have Alzheimer's and Parkinson's, but they're dying pretty quickly. Interesting. Very interesting. What's the combination? They have blood clot, hypertension, and stroke. Ooh. Unfortunate. Well, we'll try to save you, patient, but I don't know if it looks good right now. Okay, let's see. It has to work. Please, come on, just and there, we have money now, and we will treat them. Blood clot, anticoagulants, yes. Hypertension, we need 4 for the diuretics. That's perfect. It's not perfect that they have hypertension, but it's perfect that we found it and can treat it. And do this one, diuretics, 11, perfect. The fever is really bugging me. I don't know where that's coming from. And this skin rash too. Surgical exploration. What's up here? It's fever and skin rash. Okay, I hope we find it and that it's necrotizing fasciitis. It's not good that they have it, but it's good if we find it immediately. Okay? Come on, give us money. Give us money. We need money to treat patients. We need money to treat patients. Stress. And skeletal. Okay, now it works. Now it works. Okay, we have money now. Come on. What was it? This one. Necrotizing. Surgical exploration. And then it turns out it wasn't that one. Like, oh, sad. Maybe it's this one. What stuff here? Psych. Check that. Thank you. Just in case. Because look at... Oh, no. Their circulatory system. We did save them. Ah. Very sad. Oh, it's not. We wasted 6 minutes. It's alright. It's okay. I'm fine. We could have used those 6 coins for something better and they could... Oh my gosh, which one does this brother have? What do you have? Your heart already failed. Metabolic panel? The fever and irregular heartbeat. What is this? Electrocardiogram? Pulmonary. Maybe that. Let's see. Let's check your metabolic panel. We need 1 more coin for the... Wow, now all of these money here. And we found high cholesterol. Perfect. It's not good that you have high cholesterol, but it's good that we found the high cholesterol. So now let's check this. Might be that. Fever. Ugh. Now this human is a very troublesome human. Send them off to the... If it's Attack on Titan. Wow! We don't have that. I wonder what you have then. Fever, skin rash. Skin rash. Then it's this. It's skin cancer. Eyes. Anxiety. Might be this actually. 1 neuro exam. Hi, no problem. Good luck with continuing to live and keep doing that. Well, let's see. Urinalysis, that will work. We will try to save this patient while that's happening. More money, analyze the urine, and skin biopsy, and you don't have insomnia. I know! This one's... See, nothing! It's all negative! It's like, if it's all negative, then why are you dying? Not skin cancer, then what's the issue? Ah, fever. You just have laminat. What else? We checked this. It's negative. It's beyond cooked, but we don't even know if it's canola oil or olive oil or coconut oil where it's being cooked. It just might be he's allergic to the sun, so let's check that. Run the test. Wow. The headache, bro. Okay, check that. Okay, maybe the issue is he's just losing hair. And I don't know. Dizziness, or maybe he just has an aneurysm. So we're gonna check that. Let's try to save this, but I don't think this patient wants to be saved. Look at that. This was the weirdest one yet. Okay, you're allergic to the sun. Put magic setup. Oh, I would love to put magic setup on this. This is a weird patient. It doesn't want to be saved. Let's see. Let's do this one. Corticosteroids. At least we found out he's allergic to the sun. But the fever and anxiety is still not found. Let's check the abdominal CT. Wow, look at that. No cirrhosis, no gallstones, no pancreatitis, no abdominal something. So, if symptoms are not happening, it might be in the brain. I mean, the other body parts. Anxiety. How can we check all of these? Oh, wow. Yeah, I don't know though. So it's not a nervous breakdown. We're not going to do a psych evaluation. PET scan and psych will help, but we don't even have enough money for any of them. 8% life. I don't. Come on, bro. We tried. We tried to save you. It's not like I didn't do it. Come on. Look at that. Elevated. I'm still gonna click this ultrasound test. I'm still gonna click this exercise electrocardiogram to find out if you have angina, but the heart, 2, 1, bye-bye. Okay, so what's up? Stroke. Did we find the stroke? Stroke caused John Smith's circulatory system to collapse first, which then led his nervous system to collapse. Unfortunate. Very unfortunate. I think I found the stroke for this person. I don't know. Yeah. Okay, let's turn on auto collect. Let's see if that helps. Okay, and what's up here? Muscle weakness, chronic cough. Chest pain, and shortness of breath, anxiety, headache, swelling, dizziness, and irregular heartbeat. This one helps because we know it's one of these. So I'm inclined to do electrocardiography just so it hits a lot, okay? I'm just gonna set this to 2. I want it to go too quickly. Now let's go with this one. The irregular heartbeat. Electro. Perfect. This patient should live. Hopefully. Right? Yeah, it's John Smith's heart is being monitored just like this heart monitor over here. Heart monitor. Okay, so the electrocardiography yielded no results. Alright. That's bad. Then what do you have? It might be this. Metabolic panel then. Now let's see. Muscle weakness. Which one? Hello, Joyce. Welcome back to the stream. We're trying to treat as many patients as they can, but unfortunately, they are just moving on to a different part of the universe because this is the hardest level of the med school route. It is the lethal one, the very end part of the med school route, and we have to try and find 9 diseases within a certain time point, but it's a little bit tough. A strict diet plan can be used to control the caloric and nutrient intake of an individual in order to control the weight, blood sugars, and many other digestive related issues. We can use that for high cholesterol because if you have high cholesterol, you could develop fatty deposits in your blood vessels. Eventually, those deposits make it difficult enough for your blood to flow through your arteries, and then you would have blockage and boom, it explodes. So just try to not eat too much lechon kawali, and that will hopefully be fine. Nervous system. This will work, I think. I think that's fine. We have 11 bio points now. It's gonna save this patient who does not have arrhythmia and no heart attack as well. But the issue is, if they have muscle weakness, which one is it? Funny how I'm using this info to help with my homework. Exactly. It's also helping with my own science stuff because we're learning how it all connects now. The main issue is if someone comes in and asks, "Oh, hello doc, I have chronic cough po every other day." It's like, look at this. There's so many. Then yeah, that's why the Bio Inc. is a really nice game especially for the human perspective. There's also the Plague Inc., which is about viruses and bacteria, and it just helps you see how it spreads throughout the world and how you can stop the spread of it. Okay, now let's see. We have muscle weakness. The patient has muscle weakness, but I don't know which one it might be. So it might be muscular dystrophy. It's a group of genetic diseases in which muscle fibers are unusually susceptible to damage. What can we do for muscular dystrophy? So we can do muscle biopsy, where you take a small part of the muscle using a hollow needle. So that one. I think it's this one. Hopefully it's that one. I'm not hoping that the patient has that disease. It's more of I'm hoping we find the certain disease the patient has immediately so that we can save them faster. Because that's what we do. Okay, now let's find shortness of breath. We haven't found anything for their brain. I'm just gonna do a brain MRI. No, this one, it might be this. I'm gonna do an electroencephalogram EEG. It's not ECG. EEG is a test that detects electrical activity in your brain using small flat metal discs or electrodes attached to your scalp. Your brain cells communicate via electrical impulses and are active all the time. Even if you're overthinking or dreaming, especially during those situations, they're working. So run the test. And hopefully we find something so that we're not wasting too many resources for something that's not even there. Now, how about these? You could have emphysema and pneumothorax. I think it might not be respiratory failure, but monitoring 3 of the diseases will help. So bio points, go check that. We found out that this patient has chronic stress. This is bad. That's why don't be too stressed. Chronic stress is the response to emotional pressure suffered for a long period of time. Stress symptoms includes anxiety, depression, digestive problems, heart disease, and many more. If your patient is stressed, you can either do stress management, aka just a wild. I think this is the run. Is this the run? The run that will save the patient. Antidepressants ease depression by increasing levels of serotonin in the brain and are used for the treatment of major depressive disorder and other symptoms. Although antidepressants may not cure depression, they can reduce symptoms. All right, that's good. That's good. We found it. The main issue now is I want to find out why he has muscle weakness. Oh no. Oh no. Oh no, 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 no. So none of those worked. Never mind, it might not be the run, unfortunately. So we check these. Might be rickets or Paget's disease. I think it might be Paget's disease. Paget's disease. I'll just call it Paget's disease. After 8 failed attempts to 9. Are you counting? Did you count starting from the very beginning or from when you started? Because I wasn't counting anymore. Yeah, I was like not counting. I'll just be happy once one survives, because this is the lethal mode. What are you on about? So it's not Paget's or bone death. Interesting. So muscle weakness. It's not this. Then it might be this. Might be rickets. Blood calcium test, so it's cheaper. Perfect. The chronic cough is also an issue. You might just be asthmatic, or it might be sarcoid. So let's see. I'll check using this, the allergy test. Hopefully we find out if they are asthmatic, as if not, then womp womp. There you go. What else? Okay, let's save that for after these finish. Maybe we might find something. Okay, no, actually, let's see. Blood calcium tests, come on, go quicker. Nope, they are now in the ER, but plot twist. And they don't have rickets, but they are asthmatic. We found that they are asthmatic. Ladies and gentlemen, they are asthmatic. Chronic cough. So what is going on with your muscle weakness? Hemi? Neuro exam. Maybe. Muscle weakness. Brain MRI. Did we do brain MRI earlier? No. So now is the time to do a brain MRI. Might be. Yeah, we gave them an inhaler already. So it's not... Okay, finding why they have muscle weakness is stressful. Okay, let's see. It's still checking. It might be this. Did H1N1? Okay, let's go flu test. Interesting. I forgot that exists here in this game. Wow, it's not that. So what do you have? Parkinson's. Of course you have Parkinson's. Levodopa time. Carbidopa. So Parkinson's. It's a progressive disorder of the nervous system that affects movement. Tremors. Or levodopa to treat it. Boom. Now we fixed that. Now chest pain. What is causing their chest pain? Did they watch the ending of Quintessential Quintuplets? Maybe, because if their bias was Itsuki or Nino or Ichika or Miku, then unfortunately they would have chest pain from that ending. But is it pneumothorax? Maybe. I just don't have enough money to treat it. I don't even have enough money for lung biopsy. Come on, go. Okay, now we can save this. His systems are failing, but the morale is high. We can save this patient. Right. ultrasound. Okay, can you check if it's exercise? It might be this. It might be arrhythmia. It's negative. Angina hasn't been tested, so I'm gonna check for that. What else? I'm gonna check for pulmonary embolism using pulmonary angiogram because pulmonary angiogram or pulmonary arteriography is a cardiological medical procedure. Pulmonary blood vessels are x-rayed to detect arteriovenous malformations. Go. Go, my little winner. Go, go, go. Find it. Okay. Okay. Very nice. Very nice. We just need money. We just need money to treat that. First, let's get that. Let's get this. Okay, angina. It's a type of chest pain caused by reduced blood flow to the heart muscle. Angina is a symptom of coronary artery disease. Angina is typically described as squeezing, pressure, heaviness, tightness, or pain in your chest. Are you just lovesick? Maybe. So let's get aspirin. Cheaper. And how about hypertension? High blood pressure is a common condition in which the force of the body against force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. So we will use alpha blockers, and I was gonna use that, but we only have one money. So never mind. Maybe not. 34% of the patient. Oh my gosh. It's not that one. Let's get more money, please. Okay, now we have that. Well, the patient has that. Let's use diuretics just so we have just one. Now it's swelling and bruising. Oh no, there are so many choices. So we fixed this. Swelling or bruising. Issue. Might be arrhythmia, it's negative. Deep vein thrombosis hasn't been checked. It might be ultrasounds. This is so stressful, I know. Look at the heart rate. Look at my heart rate. Look at that. Okay, now, will this work? We're so close. So close. This is so doki doki and not a good way. Come on. Okay, 4. Chronic cough. Okay, breathe. Calm down. Chronic cough. Why are they coughing? It might be this. It might be sarcoidosis. Let's have them checked for that one. Okay, sarcoidosis. What is sarcoidosis? Chest x-rays, please. Thank you. Check. That should be positive. 6 out of 9. Earlier, I think we found like a 7 or 8. We found it. Sarcoidosis. How much to treat it? 6. We need 6 for the corticosteroids. Provide relief for the inflamed areas because sarcoidosis is for granulomas, aka inflammatory cells in different parts of the body, the internal ones like lungs, lymph nodes, and eyes. Wow. 1 second. Oh no, look at that. 11%. Suds. Almost there. You only have swelling and bruising now and dizziness. Why are you dizzy? Stop being dizzy then. Go white. 8, 7, 6, 5, 4, 3. Oh, it's so close. Fine. Okay. Slowly but surely, it's work. Slowly but surely, we are finding some. Yeah, I know. So close. Circulatory system and nervous system. Close enough. It's gonna be autocorrect. Okay. Blurred vision. Hearing loss. Let's fix Alport. Blurred vision, hearing loss, headache. Bring 10th patient. It's alright. Slowly but surely, we'll save them. We'll save these patients. Okay, let's go. And fast diagnosis. Oh, the diagnosis department is now letting him finding these things so much faster. Okay, here's the issue. I want to do a brain MRI immediately because of this, the heart and brain issue. Come on, go. Collect immediately. We need 10. Is it the run? I don't think so. Look at the heart, the circulatory system, and nervous system right now. They're failing quite quickly. And Brain MRI. Go. Oh, I think that let's just do 2. That's too quick. Okay, now it should work. Come on. Oh! Whoa! Hypertension, blood clot, and stroke. Okay. Chill. We found the stuff going on in his heart. Let's find out what's happening in his brain. Okay. 4. The cheapest is 4. We only have 3. Arg. And now they are in the ER. And guess what? In the emergency room, everything is cheaper. Diuretics. Bam. Let's get more money. He has Alport, I think, because of the hearing loss, maybe. Okay, that one is also enough. He has stroke. Aspirin will help. One day and boom, it's fixed. The leg swelling, it was also found. Oh my gosh. Should we invest in? No. Let's focus on anticoagulants. Okay, that's solved. Hearing loss, it's just Alport. Let's use 2 coins for that one. Get into the ER. Unfortunately. But in random... Wow, born with good genetics just now. He's already born though. Alport. Where's Alport? Alport syndrome, urinalysis. Found it. Come on, go. Hello, Decipher. Oh, that's a very good question. I think Matthew can tell you how many were already saved. None. None of them. Because we're playing the medical school route and the lethal level, so the hardest part of it. Hopefully this is the run. I wanna say, because like we kept getting super close. It's like 7 or 8. It was super close. It should work. Oh my gosh. Come on. Okay, let's see. Hearing loss, we found it. It is Alport syndrome. Treat that. Perfect. Now, which one? What's causing their skin rash and fatigue? Ooh, fatigue's disgusting. That has a lot of possible things. Skin rash, let's solve that. They might be allergic to the sun. I want to say, I'll send... Oh yeah, don't. Maybe this is the run. We'll save them. If the patient wants to be saved. We'll try our best, at least. We'll try our best to save them with the available resources that we have. Okay, so what's the guess here? If it's skin rash, it could be necrotizing fasciitis. Costs like 5 to check. And it could be UV 2. If not 7. No, that costs too much. I'm gonna use skin biopsy. Oh no, I don't want to waste. Just in case. You know, UV light testing is pretty quick. We found it. Oh my goodness. Now, corticosteroids on it. 1 second. Breathe. Look at that. Don't mind this heart rate. So, here's the thing. Headache. We haven't found anything happening to his brain, so it might be this or this. I'm gonna have to check it once we get enough money. Okay? It's gonna work. It has to work. Alright. 3 points. I think we need like 1 more or something. We treated their photosensitivity, aka allergic to the sun. Are they in Kimetsu no Yaiba? Oh my gosh, look at that. 2 might be psych or encephalo. I wanna spend less. Might be that one. The mood swings. Let's see. Okay, let's check what's the mood swings for. Headache. Fatigue. Okay, I'm just gonna do this then. It's a 1-shot check. Okay, it's chronic stress, bro. Chronic stress and nervous breakdown. We need about 6. 6 or let's say, nope, it's not encephalo. It's fine. We need money. 26%. Will they survive? Okay, come on. Oh, 6 or 3? Stress management, 5 days. Of course, anxiolytics. Now let's use 4. We need 4. Oh, come on. We just need a little bit more. Found it. Okay. 7 days. Now, it's fatigue and mood swings. For mood swings, it might be this. It might be major depression or Alzheimer's. Alzheimer's was negative earlier, so it might be major depression. So let's do that. We need 5. Are they in the ER? Are they in the emergency room? I think they're in the emergency room. What's the goal of the game? The goal of the game is to save the patient. But it gets harder and harder depending on the level. If they're... Okay, once this patient is either saved or reverse of save, I'll show you the menu. And there you go. So, for the menu, see, our heart beats around 100,000 times a day, or about 35 million times in a year. So, this game, you can actually choose if... You can choose life or death. You can choose life to try and save them, or death to try and reverse save them. But I chose life, and I do continue life campaign. And then you can click these: med school, clinic, or hospital. So for the med school route, I finished all 4 levels of internship, all 4 levels of the MD, and now I'm at the 4th level of residency. So now you see why it's difficult, because it's the last one of this. Look at the number of attempts: 7 attempts, 3 attempts, 25 attempts. The closest one was 8 out of 9, with only 1 second left. And then for the clinic, not these. Not that yet. And for the hospital, well, I didn't even try that yet. Because to unlock the next levels, you need like more hearts, and these are the hearts. And this is my current heart level, 16 at the top right. Yes, I can't even play the ICU yet. They're telling me that I'm still weak. So I'm just gonna try the med school route again and try to get this last heart from here. We can do this. I think we're getting pretty close. Let's do still John Smith for the name. And let's see. Disease. Okay, I'm gonna choose this. Collapse. Decrease systems collapse speed by 30. We need that. We really need that. They're just dying so much quicker. Recovery starts at 10%. No, I only have 4. All diagnostic tests are 10% cheaper. This will help. Yeah. And then lifestyle. We only have 1 XP to spend now. How about this? Oh, we can't. We don't have enough anymore. Okay, let's go. Hopefully that helps. So their systems will decrease at a lower speed, and diagnostic tests are a bit cheaper. So what's the situation? They might be allergic to the sun if it's skin rash, headache, shaking. Okay, brothers and sisters, it's gonna be a brain MRI. I'm gonna do a brain MRI. High chance that it's Parkinson's for this human. Go, go. And let's do 2. Times 3 is 2. Doki doki. Come on. Almost there at 10. We need 10 points for the MRI. Come on, the last one. There, we have it. MRI, 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 MRI. This will be, is this really, is it? It should be. Brain MRI, go, go, go. Brain magnetic resonance imaging test is being performed on John Smith. Oh my gosh. Renal. Okay, now. Heart. What is up with their heart? Their brain MRI is almost finished, so I'm just gonna wait for that and treat it. Ooh, Parkinson's, stroke, blood clot, hypertension. The big boys. He has the big boys. Levodopa, not enough money for that. Stroke, let's treat stroke. 2 days. Good. And this one, diuretics, water. Okay. Diuretics, sometimes called water pills, help get rid of your body of salt or sodium and water. Most work by making your kidneys release more sodium into your urine. The sodium then takes water with it from your blood. That decreases the amount of fluid flowing through your blood vessels, which reduces pressure on your vessel walls. Good. But it's not good that they have it. It's good that we found it immediately. Come on. Please. Are we doing fine? We just need more money for Parkinson's. The blood clots, no. How much was it? 14? Ah. More money then. Quickly. Come on. There, treated 2. Skin rash is an issue. I think you just might be allergic to the sun. But no. I'll just spend the money we have right now for the levodopa treatment. I think they're gonna get sent to the ER very soon. With that, their circulatory system is dying. Okay, fine. I'm just gonna save them. Now. There. And they'll get sent to the ER really quickly. And now. Oh, not yet. Interesting. Come on. And now they're in the emergency room. So to win in this mode, yes, you need this. This is the objective. 9 out of 9 diseases. The closest we got was 8 out of 9. Exactly. Very frustrating. I know. It's alright. We can do it. Kenchana. Headache. Disease, chest pain. Ooh. Interesting. Shortness of breath is an issue. Chest pain. Headache. Only this, huh? Wow. We need 1 more coin. Interesting. Did his brain explode? Oh, yeah. Right now, his brain is almost dead. Nervous system is at 6%. Circulatory, his heart is bye-bye now. Headache. Electroencephalogram. And then I want to see and check using a brain MRI. Go. I think we did a brain MRI already and it yielded 0. Ooh, chronic stress. It is chronic stress, so we need 4. I'll just use 4 coins on it. Oh my gosh. So close, Jay. Well, it's not, but you know, it's always almost close. And you don't have brain aneurysm. Sad. Well, it's not sad that they don't have it. It's sad that we use the resources on it, you know. Shortness of breath, dizziness, it might be this. So let's use 2 coins on this patient. Hopefully they survive. Okay. You're just allergic to the sun. Go join Kimetsu no Yaiba if that's the case. Okay. Nice! See, I told you you are allergic to the sun. We just need 2 more coins. And we can treat his sun allergy. Save that. Thank you. Shortness of breath. Joint pain. Old. Cute old man. Old. Arthritis. And Paget's disease. Joint. Interesting. It might be one of these. I'll use bone biopsy then. How much was it? 6? Oh. No, this is just 6 out of 9. Arg. Very arg. Come on. No, it's bone biopsy. I said bone biopsy. There. Skin rash? Bone biopsy. I don't want that. shortness of breath. Oh, what if? Asthma. Maybe. 6 out of 9. Look at that. If we find the remaining 3 but not... Oh. What? What killed you? Stroke caused John Smith's circulatory system to collapse first, which then led his nervous system to collapse. Unfortunate. Very unfortunate. Alright then. We'll save them next time. But yeah. I think let's just try one different mode. No, I'll save that. I'll save that for next time. For now, I will rest my voice because I was yelling at the screen for too much. Lol. But yeah, I think that is it for today. Thank you for watching. Bye.